So, good morning. This is my Redem for sinuses, nose, and mouth Redem video. And so, we'll start. Good morning, sir. My name is Joseph Pospos. I'm your student nurse for today. May I know your name, please? So, good morning, Sir Ibo. I am here to do your nose, sinuses, and mouth assessment. And this is to find an underlying problem or potential problem within your sinuses, mouth, and your nose. So in this procedure, I will be touching you. Would that be okay, sir? Alright, so first thing we'll do is wash our hands and start with the procedure. So let's start with inspecting the patient's sinuses. So the patient's first thing we will check is for the frontal sinuses. So for the frontal sinuses, the patient's there is no periorbital edema and no discoloration. And next thing we'll inspect is for the maxillary sinuses. So the patient's maxillary sinuses also has no periorbital edema and no discoloration as well. Then next thing we will do is trans-illuminate the patient's frontal sinuses and also the patient's maxillary sinuses. So let's put on our gloves to prevent transmission of bacteria. Keep our patient safe and also ourselves. So next thing we will do is trans-illuminate the patient's frontal sinuses. Wait lang sir ha, kamay lang sir. So, red light is seen in the upper eyebrow of the patient. This thing we will do is trans-illuminate for the maxillary sinuses. Baka sir, kamay sir. So, the red light can be seen from the patient's from the patient's palate and the roof of the mouth and the patient's palate. Then next thing you will do is palpate for the patient's frontal sinuses and the maxillary sinuses. So let's palpate first the frontal sinuses of the patient. And not for any tenderness. Ino sakit sir ha? Wala sakit sir. Right, so there are no tenderness present in the frontal sinuses. So next thing we will do is palpate in the maxillary sinuses. Ito sir. May sakit sir, wala lang. Alright, so no tenderness and also no pain to the patients or any kind of lesions. Then next thing we'll do is percuss the patient's frontal sinuses and maxillary sinuses using direct percussion. So, hindi ako sakit sir ha? So, resonant sound is heard. Then there are no tenderness that is also noted. So next thing we'll do, we'll proceed with the nose of the patient. So let's inspect the nose of the patient, its position, shape, and symmetry, and its color, and for any kind of lesion. So and also drainage. So the nose of the patient is midline, is intact, and no lesions that are present. It is also symmetrical. Then there are no drainage that is visible. The next thing we'll do is inspect for the patient's nasal mucosa. So what we will do is tilt the patient's head, then inspect for the patient's nasal mucosa. Alright, so the patient's nasal mucosa is pink and moist and is intact and no perfusions or drainage that is visible, and symptom is also in midline. Alright, so next thing you will do is while inspecting the nasal mucosa of the patient, we were also inspecting the patient's turbinate. So the medial and inferior turbinates is visible and also symmetrical and consistent with the patient's facial appearance. The next thing you will do is assess for the patient's patency of his nares. So first thing we will do is assess for the patient's nares. So let's start to the right side first and the left as well. So the patient's nares are patent and the cartilaginous portion of the nose was mobile as well, and it's intact and symmetrical. So and no sakit sir pagduot na ako sir, sakit na feel rara. Alright, so no tenderness or any swelling is present. Alright, so the next thing you will do is inspect the patient, assess for the patient's mouth. So first thing you will do is inspect the patient's lips. So, sir, so the patient's lips is midline and symmetrical and skin is intact. Then it is pink and moist. Then the patient's mouth also has no unusual odors. Then the next thing we will do is inspect for the assess for the patient's teeth and assess for the patient's teeth and bite. So sir, can you please ablihin mong baba sir, palit sir. Dayon. Yes sir, ablihin baba sir. Then close your mouth sir. Alright, so the patient have 22 teeth and it is white, then it with good occlusion, and also also has a good repair, and the patient's teeth is not loose as well. The next thing we will do is for the inspect for the patient's oral mucosa and the patient's gums. Sir, please kong baka nga sir. Yan sir ha. Yan sir, yung gums. Right, so the patient's oral mucosa is pink, moist and intact, and also the patient's gum is consistent with the other mucosa and it has no bleeding. Alright, so the next thing you will inspect is for the patient's hard and soft palate. So sir, hanggat ng gamay sir. Baka nga sir. Alright. So the patient's hard and soft palate is intact and also smooth and is pink. The next thing we will do is inspect for the patient's salivary gland. So first thing we inspect is the Stensen's duct. Then next thing we will inspect is the Wharton's duct. So mga sir, kamay sir. Yan, sakay mong dila sir. Ana. Dili sir, dita ka solid pagka isaka. Right. So sakit. So the patient's Stensen's duct is intact and buccal mucosa is at the level of the second of the molars, then is the Barton's duct is also intact on the either side of the frenulum. Then the neck, both mm, both glands, both ducts are moist, pink, and has no swelling or any nodules that is currently present. The next thing you will do is inspect the patient's tongue. Pagawas imong dila, sir. Sir. Pagawas imong dila, sir. Pagawas jud mi ayo. Paubos, sir. Ipaubos. Alright, then saka, sir. Alright. So, the patient's tongue is pink and moist. Then, mucosa is intact. Then, papillae is also intact. Then, and is kaya po kando, sir, correct, sir, igimok-gimok yung dila. Right, so patient's tongue is freely and symmetrically mobile. Then next thing we will do is the oropharynx. So sir, ipagawas gyapon yung dila, sir. Inatorog gyapon, sir. Like katong gawas dito, sir, gawas kanang ipagawas mi na, sir, ipaubos na yung dila kanang. Alright, so the patient's oropharynx is pink and moist and intact and no lesions or swelling or any discharges that are present. Then next thing we will do is for the patient's tonsils. So, sir, bangag yapon, sir. Ipagawas gyapon yung dila, sir. Minayo, sir. Ala lang, sir, ala lang, sir, tingog, sir. Right, so the patient's tonsils is level 2, which is normal. Then the it is symmetrical, pink, and has clean crypts and no lesions or any redness that are present or swelling. Then next thing you will inspect is the patient's uvula. So sir, ito gyapon, sir, ipagaw si mong dila, sir, din anak, sir, anak, sige, sir, tingog, sir. Alright, so the patient's uvula symmetrically rises and it is pink and is midline, moist, and without lesions as well. Alright, so the next thing we will do is palpate for the patient's lips, firmness and consistency. So, gamay sir, ha. Ina kung sakit, sir, ha. Wala na sakit, sir. Alright, so there are no present of tenderness and patient's is soft. And next thing we will do is palpate the patient's tongue for its firmness and consistency. So sir, pagawas imong dila, sir. Right, so ubos, sir. Alright, so the patients wala na sakit, sir, pagkanaan dot ako sa dila. May lamig lasa ang gusto. So the patient's tongue is firm and has no presence of tenderness, no lesions or nodules. Then next thing we'll do is palpate for the glands. First thing we'll palpate is the parotid glands, which is just in front of the ears. Then lastly, we will palpate altogether the submandibular gland and the sublingual gland. So first thing we do is the parotid gland. Then next thing we will do is the submandibular and sublingual gland. So it's not palpable, and in the submandibular and the sublingual case, and they may be They may be palpable but has no swelling, tenderness, or no juice that's present. Then last thing we will do is we'll test for the patient's gag reflex. We'll make use of our tongue blade to test the patient's gag reflex. Sir, pagkawas yung dila, sir. Panganga, sir. Diha na sa sulod yung dila, sir. Sa sulod ra. So the patient's gag reflex is positive. Then after the assessment, you take off your gloves. Then wash your hands. Then document the data that's just recorded. That would be all.